Hi folks, I am Sinead Curran, Chartered Physiotherapist, and with me here today I've got Sarah Fitzgibbon, and she is going to talk to us about medication for osteoporosis. So we're probably not going to get too much into the nitty-gritty, Sarah, of osteoporosis itself and what exactly it is, but we might just do a little bit of a run through that, if that's okay with you, and then we'll talk a little bit more about medication, what it is, why people need to take it. So thank you very much for joining me, and thanks very much.
No problem at all.
Okay, so I suppose the first place to start is just a little bit of background into osteoporosis, probably not too much. Most people will get a diagnosis of osteoporosis based on a DEXA scan. And when I first see people with osteoporosis, usually they've had a DEXA scan, and that's what they bring to me, and that's what they show me. What is a DEXA scan, and what is it telling them?
So a DEXA scan might also be called a bone density scan. So you're trying to see the strength or the density of bones. And this is based on the fact that bones are a little bit built like brick walls. So they are built up and broken down over the years. So the little bricks get built up and then they get broken down by the cells that are working away within the bones. That's the normal way that bones work. But over time, what can happen is that there are more bricks broken down than built up. And so the wall gets a little bit thinner or less strong. And that if you were to bang against the wall, or the wall was to be knocked, that it's much easier for it to break. So that's how I would usually explain it to patients. So the wall, the density or the strength of the wall is being changed over time as we get a bit older, and it gets a little bit thinner, or sometimes people refer to things like brittle bones.
Okay, and this happens to men and women?
It happens to men and women. It happens more commonly to women as they get older, so it's more likely to happen to women who are around the age of menopause, or certainly as they get older after menopause, and it can happen to men as well. Okay,
and can we feel it happening?
So it's not something. So most of the time, as you said, most of the time people don't know that this is happening until they've had the bone density scan or the DEXA scan. The bones themselves won't give pain, they won't give any symptoms until something like a fracture or a break happens. Okay. So it might be something small, a small fall that previously you wouldn't have noticed, but that when the bones have lost their strength, that a small fall can cause a break in for example, your wrist, or maybe in your hip, and from a fall that you wouldn't expect to give you that injury. And that's often when people would have the diagnosis made.
Okay, so quite often the fracture or the break will happen first, and then the DEXA scan is the diagnosis.
Exactly.
Okay. I was talking to Aoife MacDonald, a registered dietitian, a couple of weeks ago on a chat like this, and we were talking about nutrition for osteoporosis. I know a lot of the people who attend my classes are sick of hearing me talking about the effects of exercise and the various different reasons why exercise is important for people with osteoporosis. And Aoife spoke about nutrition and how nutrition provides, I suppose, the materials for those building blocks that you were talking about, provides the concrete and the mortar. And it's well known that lifestyle factors are very important in terms of preventing and managing osteoporosis. But what seems to get talked about a little less often is medication. And medication is another pillar for care for people with bone density issues. Why is it that some people are on medication, some people with osteoporosis are on medication, and other people aren't?
So again, getting back to the fact that a lot of people who have osteoporosis aren't aware of it. So obviously, if you don't know you have it, the chances of you taking a medication for it are small. And again, I suppose what you're talking about in terms of things like prevention, if you can prevent at an earlier age with good diet when the bones are being formed, and again, keeping up your exercise, that's obviously going to be a great help for how the bones are built up. But when the bones have started thinning, when this breakdown starts happening, we want to try and prevent that wall from getting any less strong, any weaker. And that's where the medication comes in. So the medication helps to build up the bones, to build up that mortar between the bricks, or in another way that they work is to stop that mortar being broken down. So the most common types of medications that people would use would be something that we call bisphosphonates. And again, they're working by trying to prevent this breakdown of the bricks of the bones. They are the medications, people might be familiar with them because they're taken maybe once a week or sometimes once a month. And so just one tablet per week. And the idea of that is by maintaining that treatment over time, that you're building up the strength of the bones again and preventing the fractures.
Okay, and there are different types of medication, bisphosphonates being one, and then there are other types as well that people will be on for various different reasons.
Mm-hmm.
Is it a personal preference? Is it something that depends on other things that are going on? It just depends on your risk, or how does a GP decide, and how does a GP decide to change what somebody might be on?
Yeah, so I suppose first thing is to decide who would need a specific type of medication or who needs medication at all. And again, that would come down to something like the DEXA scan, but also other things like what that we would call risk factors. So some people are a bit more likely to have problems with their bones. So if the DEXA scan comes back and says that your bones are a little bit thinner than we would expect for somebody at the same age as you and the same gender as you, and you have other risk factors, so those would be things like a family history. If somebody in your family has previously had osteoporosis or previously had fractures like hip fractures or wrist fractures that weren't expected. If you are a smoker, if you are a person who would have had a lower body weight throughout your life, and maybe some of fewer of those preventative things that we were talking about in terms of diet and exercise throughout your life. If you are on certain other medications, so you might be on long-term medications for other reasons, certain types of arthritis like rheumatoid arthritis would make your risk of osteoporosis greater. So the GP is generally going to take the whole picture of your situation, so all of your risk factors plus the DEXA scan, and we can sort of make a calculation or work out who would benefit most from medication. So we're always making sure that we're giving medication to people who would benefit most from it, so that you're not taking a medication just because of a number. You're taking a medication based on your personal overall health picture. And then the different types of medication will depend again on other factors. Maybe occasionally can be to do with things like your blood test results, so to do with your kidney function or any other medication that you're taking, or how it would be for you in terms of taking different types of medication. The bisphosphonates that we mentioned that you could take once a week or once a month, they have to be taken in a particular way on an empty stomach, and you need to be able to sit up after you've taken the medication for roughly half an hour afterwards. That doesn't suit everybody, or it doesn't work for different people's lifestyles, or they might find that they would choose to take one of the other medications. For example, there's a medication called Reluctane, which is based on the protective effects of estrogen in our body. So the female hormone estrogen is good for us in lots of ways and is good for our bones. And this medication uses that beneficial properties of estrogen to help build up the bones, keep them as strong as they can be. That medication for some people can also reduce the risk of certain types of breast cancer. And again, for certain people that would be important based on their family history.
Okay, very good.
Then there's an injection type medication, which is only used, which you just need to get every 6 months. And again, that might suit people a little bit better if it's harder for them to take medication, or again, if they have other conditions or reasons that they can't take a weekly or monthly medication, then getting an injection every 6 months would suit them better.
Okay, so there are a lot of options, but they're well thought out decisions. It's not a case of if two people have osteoporosis and one person is on one medication, that they're on the wrong medication because their friend is on another medication.
Exactly. It's always going to be individualized and tailored to the specific person, depending on all of the other, as I say, everything else going on in their lives, plus any medications, plus any other illnesses or difficulties that they have.
Yeah, perfect. And one of the things that people ask me about quite a bit is the risks of taking osteoporosis medication. And I think people have genuine concerns about the risks of taking osteoporosis medication to the point that they either won't take it or they'll stop taking it after it's been prescribed. Can you tell us anything about the risks and about the reality of the risks versus the myth of the risks, and maybe shed some light?
Sure. So I mean, it's understandable if you're given a new medication to take, you're going to want to know about any potential side effects. And particularly if you're asked to take a medication for a condition that you're not really fully aware of, it doesn't bother you, it doesn't stop you from doing anything. Particularly if you haven't yet had something like a fracture, the idea of taking a medication for a condition that you don't have any symptoms for can sometimes seem off-putting. And if you have spoken with people about the potential for side effects, or if you've heard about something that happened to somebody else, that can understandably maybe change your decision about taking the medication. At the same time, there are thousands and millions of people taking medication like this all around the world without any difficulties and without any problems. The medication will always be monitored by your doctor. And if you are finding that you are having any difficulties with the medication, it's really important that you would speak to your doctor about that rather than just stopping the medication. Because as I mentioned, there are other choices, and it might be that a different type of medication might suit you better. Sometimes the types of things that people would be concerned about would be, first of all, as I mentioned, with the bisphosphonate medication, sometimes just the actual taking of it can be a little bit off-putting for people. Sometimes people find it hard to remember to take something that's once a week or once a month. They sort of miss the day or they miss the date,
yes,
and then it's moved on. They say, well, I'll just skip it till the next month, and then the next month passes again. So it can sometimes just be something as simple as having a reminder on your phone or on the calendar about taking the medication. In the past, the bisphosphonate medication was sometimes given for quite long periods of time without necessarily checking to make sure that it was definitely working for that person and that it was definitely the right medication at that time. And for some people in the past, they might have had some side effects which included different types of fractures. So while the medication is there to prevent fractures, if it's used for too long in certain people, it can cause different types of fractures. And understandably, that put people off straight away. But again, we've learned a lot about that since the medications first became available. And we now know that it's best to check in with the person after 4 or 5 years, depending on their risk factors, but generally after about 4 or 5 years. And we sometimes would then recommend that actually taking a break from the medication for a little while, watching what happens with the bones. So generally we would expect that the bones again have built themselves up during that time, that the density of the bones has increased in that time. And then we would watch again with things like another DEXA scan and wait and see what happens. And if medication is required again in the future, then we can use either different medication or use the medication in a slightly different way. So again, it's about being monitored, being watchful, and any side effects can occur for any medication, but looking at the positive benefits can sometimes help a person to realize why it's worth continuing with the medication. So if you're looking at the reduced risk of pretty serious fractures that can happen for people, that can sometimes be a good motivation to help people to stick with their treatment plan.
Yeah, so the message really is it's an ongoing, once it's been decided that you would benefit from medication, it's an ongoing care path, that it's not you get your prescription and off you go and we refill it every 6 months and then we may or may not see you ever again. It's an ongoing monitoring, it's an ongoing conversation that people should be having with their GPs rather than deciding that the medication is not for them without having had that conversation or those conversations and making informed decisions.
Exactly.
So it's pretty much a rest of life type conversation you'll be having more or less for the rest of your life with your GP?
I mean, if you're somebody who has risk factors for osteoporosis, if you've had a DEXA scan that has determined that you do meet the score, we'll say, for osteoporosis, that isn't something that you can take one tablet and it's gone, that it's fixed. It is something that requires ongoing management and treatment. And again, what you do with in your own life in terms of your nutrition and your exercise, as well as the medication that you'll be speaking with your doctor. So yeah, absolutely. It's an ongoing care plan. It is important to bring it up with your doctor anytime that you have any questions or concerns. And if you, as I say, do have queries or questions around side effects that you might have heard from somebody else, it's absolutely worth sitting down with your doctor and having a chat about that and working out what's best for you.
Okay, and this is kind of a little bit of a sidetrack question, but in this era of COVID-19, and because it's going on now for 6 months, and it could potentially go on for another 6 months and even longer. For people who feel, again, because osteoporosis doesn't cause any pain, or in and of itself doesn't cause any symptoms, and people might be pushing it into the background of their list of things to care about. If people are having trouble, either need a prescription filled or need follow-up, need to visit the GP for an injection, or they're concerned about something with regard to their osteoporosis, I'm assuming GPs' phone lines are open, doors are open,
Absolutely.
if needed.
Absolutely. Yeah, so absolutely. You know, we're available for a chat on the phone at any stage, and again, particularly around any questions that people may have around their medication, how to take it, when to take it, any of those things. And we are available to see patients if necessary. And again, people who have concerns, if there's anything that you're concerned about physically in terms of pain or side effects, really important that you would come in physically and see the GP. When we've all been shut in for so long, it can be a little bit daunting to get out there again. But your GP surgery will be, you know, set up in a way that is safe for you to come into. All of the, you know, hygiene controls are in place. Any patients who are at high risk for COVID will be managed in a particular way. We don't see patients with COVID symptoms in we'll say, the ordinary GP surgeries anymore, and that's to protect the patients who do have ongoing health problems and who need to be seen. So there shouldn't be any concern for people about coming into the GP surgery. It's a safe place to be, and it's an important place to be if you do have any symptoms. And as I say, a lot of it we can have a chat about on the phone first, and that might be encouraging for you. For people who are taking the 6-monthly medication, the denosumab or Prolia injection, it is really important that they would come and get their injection either when it's due or certainly within 2 months of it being due. That medication requires a blood test beforehand. So that might mean, again, 2 visits potentially to the GP surgery. You have to come for the blood test and then come back for the injection. But again, all of that will be safe, and all of that is in order to keep you safe and to not lose any of the benefit that you've already got from getting your injections, for coming regularly for your injections. It's really important that we would keep that up to keep those bones as strong as they can be.
Brilliant. So don't wait until COVID-19 has passed. Keep
Definitely
going with your path of care. Yeah, perfect. Yeah. Last question, and it's one that I think I know the answer to anyway, but it is a question that people have asked me before. I know the answer to it, but it's a question people have asked me. In terms of medication, you have spoken about the risks, you've spoken about the benefits, and the benefits you've spoken about are the tip of the iceberg benefits. There's huge benefits to people doing whatever they can to prevent fragility fractures, not just in the next year of their life, but all the way through to their 80s, their 90s, and maintaining their quality of life for as long as possible, and being able to do what's valuable to them to do for as long as possible. But I have been asked about looking after diet and doing exercise, and is that not enough without the medication? And I've also been asked, not infrequently, about natural alternatives to the medications prescribed by doctors. Any thoughts? I know you have thoughts. Share your thoughts.
So it would be absolutely great if changing our diet and keeping up with our weight-bearing exercise and doing those kind of things, and you know, taking natural remedies, if that was enough, that would be fantastic. But the research doesn't back that up, unfortunately, so that we know that people who have osteoporosis are at increased risk of these serious fractures. We know, for example, with something like a hip fracture, which can happen from a very simple fall, that really does lead to an awful lot of, obviously, mobility problems. So people ending up losing their independence that they would have previously had. So maybe somebody in their late 70s, really active, going, you know, golfing every week, getting out and seeing the grandchildren. And then they end up with a hip fracture from a very simple fall. And they're finding that they're now suddenly almost, you know, housebound, or that they're much more limited in what they would have been previously. And in fact, people who have hip fractures have an increased risk of death in the following year afterwards. So it is very, very serious. It's not just as simple as a plaster of Paris on your hand when you're a teenager. So those can be serious. And again, if we thought that eating well and exercising well prevented all of that, that would be fantastic. But we know that that's not the case. What we do know is the medications can reduce the risk of something like that happening by 40 or 50%. It can reduce the risk of fractures in your spine happening by even more than that. So we'd be familiar with the idea of people getting a little bit shorter as they get a bit older, and that can be sometimes to do with small fractures happening in the little bones of your spine. And those in themselves are something that you mightn't even notice. But over time, you find that you have this pain in your back you can't quite explain, and then you have a different pain, and then it's moved a little bit. And it turns out that the little bones in your back, they've all gotten so thin that they're not very good at keeping your weight up, and they become a little bit closer together. And then you actually lose height, so you can be shorter than you were when you were younger. Or in the olden times, be familiar with maybe somebody who had like a hunched back almost from having these fractures. So older women, and even that just appearance of a sort of an older person, look, none of us really wants that either. So for people who are very invested in their own health, and they really want to be as healthy as they can be, and they might want to do things as naturally as they can, I can totally understand that. But the medication is proven to work. It's proven to reduce your risk of these things happening to you, meaning that you can continue with your active, healthy, independent lifestyle for as long as possible. And the risks associated with the medication are very small, and again will always be monitored by your doctor. And the benefits, when you think of it that way, the benefits absolutely outweigh the risks.
Yeah, so the medication, the prescribed medication, facilitates your lifestyle, your healthy lifestyle, as you said, rather than inhibit it.
Absolutely.
And it allows you to continue it
Absolutely.
long into the future.
Absolutely. So in the same way that you might take, a herbal remedy or a supplement, to improve your quality of life, that's how I would be looking at these medications. They are a preventative medication. They are helping your body to stay as strong and as healthy as it can for as long as possible. They are slowing an aging process that doesn't need to necessarily happen. So these are all good things.
Yeah, and it's all evidence-based. It's all very heavily research-based with decades of research at this stage, which we have the benefit of, thankfully.
Mm-hmm.
Thank you very much, Sarah. That was brilliant.
No problem.
I have no more questions. I think we will finish up there. I'm going to put a link to the Royal Osteoporosis website and the International Osteoporosis Foundation website on the video clip as well. And both have oodles of information. You could mine through those websites for days and still find some new stuff, but it's useful, practical information for anybody who wants to take a look, and it reinforces everything Sarah's just said. So thank you very much, Sarah.